Bismillahirrahmanirrahim. Subject: Adrenergic and cholinergic receptors. Adrenergic receptors are classified into alpha and beta receptors. Further, alpha is alpha 1 and alpha 2, beta is beta 1, beta 2 and beta 3. Receptor location and its function. Alpha 1, present in blood vessels, skin, mucosa, abdominal viscera, kidney and salivary glands. Its function is constriction of blood vessels and dilation of pupil. Alpha 2 receptors, axon terminal and pancreas. Its function is inhibition of norepinephrine and insulin. Beta 1, heart, kidney, adipose tissues. Increase heart rate and stimulate kidney to secrete renin. Beta 2, lungs, blood vessels, heart, liver, skeletal muscles. Function include dilation of blood vessels, bronchioles, relaxation of smooth muscles, digestive, urinary and uterus. Beta 3, adipose tissue, stimulation of lipolysis by fat cells. Now come towards cholinergic receptors. So they are classified into nictonic and muscarinic. Nictonic are further NN receptors, that is neuronal receptors, and NM receptors, that is muscular receptors. So neuronal receptors are present in autonomic ganglia and adrenal medulla. Its function is excitation. While the muscular receptors are present in the neuromuscular junction, so its function include usually excitation, inhibition of cardiac muscle activation. And the muscarinic are M1, M2, M3 and M4 and M5. The function of M4 and M5 both are present in the CNS and have inhibitory effects. While the M1 is present in the gastric glands and also present in saliva, so stomach and salivary secretions. M2 are present in the heart, so they decrease heart rate and force. While the M3 is present in the smooth muscles, exocrine glands and endothelial cells, while its function is constriction of the vessels and bronchioles. So hope you will have idea about little about idea about cholinergic and adrenergic receptors. Thank you.